My name is Kyle Dorsey. I'm the Vice President of Operations for Baptist Health downtown. The chance of having an active shooter at Baptist Health are rare, but it is possible, and you must be prepared. The more you know ahead of time, the better your chance for survival. Active shooter emergencies are unpredictable, and they can happen anywhere, at any facility, in any department, or in any office setting. You have just seconds to react, but there are 3 key things you can do to increase your chance of survival: run, hide, or fight. Baptist Health's leadership is committed to providing a safe working environment. However, should the unimaginable occur, being prepared will help to save lives. Run, hide, or fight has been endorsed by the Department of Homeland Security and our own security team. If there is an active shooter at Baptist Health, you should hear an overhead announcement, "Active Shooter," followed by a description and location of the subject. The announcement will be made 3 times, and these announcements will continue during the emergency. You should run only if the active shooter incident is occurring in your building. If your building is not connected or adjoining to the building in question, you should shelter in place.
I'm Jay Farhat, Executive Director of Security for Baptist Health. We recognize that some of what I'm about to say will feel counterintuitive to healthcare providers. There is no perfect plan or training that will prepare everyone for every scenario. However, these guidelines offer the best chance for our team to ensure the highest level of safety for the greatest number of people. You should consider run as your first option. If you can't run, then hide. Your last option may be to fight. You are trying to buy time for law enforcement to arrive. Active shooter incidents can be over in just a few minutes. You want to stay safe until help arrives. First, no matter where you are, run. If you know where the shooter is, run away from that location. If you're in a patient's room and that patient is not mobile, you must save yourself if you can. Make the room dark, turn off the television and lights, tell your patient to be quiet, close the door and run. I know that this is hard, but it's important that caregivers save themselves so that they're able to take care of their patients or possibly their coworkers after the emergency. Run. Leave the area immediately with an escape route in mind. If you know where the shooter is, run away from that location. Evacuate and bring as many others with you as you can. If some people choose to stay, don't stop, you should go. Discourage anyone else from entering the area. If you come in contact with law enforcement officers, keep your hands raised and visible. Do not point, yell, or make any sudden movements towards the officers. If you're not able to run and you're in a patient's room, you must hide. First, barricade the door. Barricade the door by rolling the bed in front of the door and locking the wheels in place. Please make sure the patient is not in the bed before you do this. Chairs, tables, sofas, or any other item should be placed behind the door if possible. Next, you want to make it dark. Turn off the television and lights. Close the blinds. Then make it quiet. Ensure all electronic devices such as pagers, cell phones, viseras, anything that may make noise are silenced. Keep in mind that many violent events in the workplace involve a coworker. When hiding, do not open the door for anyone except law enforcement. Stay in place until you hear an all clear from authorities. Avoid the fatal funnel. This will keep you out of sight of the shooter, especially if there's a window in the door. You should then move yourself and patient into the bathroom and get as low to the ground as possible to ensure you would not be in the line of fire if the assailant attempts to shoot through the door. Plan to fight. Only fight if it's your last resort. Look around the room for improvised weapons and IV poles. Scissors. Oxygen tank. A battery from a workstation on wheels could be used as a weapon. Look, you're in a fight for your life. Act as aggressively as possible. You must incapacitate the shooter by throwing objects, punching, striking the assailant with all your might. Let's recap our steps for hiding in a patient room. 1. Barricade the door. 2. Make it dark. 3. Make it quiet. 4. Prepare to fight. If an active shooting occurs in an office or common area setting, you will follow the same guidelines of run, hide, fight. First, no matter where you are, run. If you know where the shooter is, run away from that location. If you are not able to run, you must hide. Choose an office or room that's capable of being locked and preferably has no windows to the interior of the building. Several rooms at Baptist Health are marked as a suitable location to hide if you're unable to run or flee the scene. Add another level of safety by barricading the door. Move any solid or heavy objects in front of the door. You can take a chair and wedge it under the door handle. If the door has a hydraulic arm, use a belt or an electrical cord to tie around the arm to prevent the door from opening. Next, make it dark in the room. Turn off any computer monitors, TVs, and lights. Close the blinds or pull the drapes. Next, make it quiet in the room. Turn off any radios, silence pagers, cell phones, and Viseras. Plan to fight. Only fight if it's your last resort. Look around the room for improvised weapons. Scissors, fire extinguishers, a knife, or a chair can be used as a weapon. As I said before, you're in a fight for your life. Act as aggressively as possible. You must incapacitate the shooter by throwing objects, punching, and striking the assailant with all your might. If possible, act as a team to overwhelm the assailant. Remember, there's strength in numbers. Get low to the ground and make sure not to position yourself in front of the doorway. Remember the fatal funnel. Active shootings last on average 4 to 11 minutes. However, the lockdown can last for hours. While law enforcement evacuate and clear the building, if you're barricaded inside of a room, be prepared to stay there for a long period of time. You'll need to stay inside these areas until you get the all clear from law enforcement or via an overhead page. Even if the fire alarm's going off, you should only evacuate if you see flames or smoke from a fire. The whole idea behind run, hide, fight is to get you and others to a location that's secure as possible. At the end of the day, it's your job to make it home to your family. An active shooter event probably won't happen in your department, but everyone at Baptist Health must think about what he or she would do if it did happen. Watch this course more than once, talk about it, talk to your colleagues, and look at your surroundings. Where's the nearest exit? Where are rooms that have doors that lock? Where is secure hiding space? What objects can be used as weapons? Think about what you would do to survive. Your life just might depend on it. If you'd like specific training for your unit or area on where to run, hide, and if you absolutely have to fight, please contact security to set up an assessment of your area. Thank you for your time.